My patient relatives like verbally assaulted me, said like the meanest things to me. So I cried, man. I cried. I was like, nah, I don't think I can do this medicine to me. Patient relatives are not your friends.
They always bring it back to the doctor's thought, like, okay, doctor should show more compassion. I'm like,
so your response, even when you a random person on the street that is not showing
compassion,
you will not start hitting the person.
It's just really build relationship.
Yes.
And it's not like doctor, like across all sectors, like doctor, nurse,
especially with those people are doctors.
lab.
Send a pastor money, 1.3 million to pray.
You serious? I swear. That's crazy.
There's nothing that will bring it to your consciousness that life is just perfect.
Especially as a young doctor, you're just starting to protect yourself emotionally, mentally, because you need toxic things.
I swear. And I feel like at that point you're like sponge.
You're just absorbing
things. Like I think at the end of the day that's what it means to fall.
Yes. Drum rolls. Introduce yourself to the audience.
Hi everyone, my name is Dr. Okafo Oguchukwu, a medical officer. So I did my housemanship at Asus Sparkling. I recently just finished, so my information is fresh.
So on a scale of 1 to 10, 0 being like nothing, and then 10 being PTSD, like trauma, like the ghetto trenches, rate like your housemanship experience and how traumatized you are.
Okay. I'll give it a solid 3.
Are you serious?
Yes. Like I was not traumatized by house job.
Are you serious?
Yes.
I just answer.
I suffered small, yes, but obviously I can't say trauma. I was not traumatized by house job actually.
Are you serious?
Yes, like I've been thinking about my house job experience and I realized that I didn't have such a terrible experience. So I'll give it a solid 3. Based on the scale.
Based on the scale, I'm actually surprised though. Wow. So this video should be like mostly doing the talking. I'll just be doing the accent. I'll just chipping here and there when I want to. So like the medical school prepared for house job, like before you went to house job, did you feel prepared enough?
No. I don't think medical school did anything to prepare me for house job other than like the medical school stuff.
Okay.
Yes, because it didn't even prepare me for how overwhelming, how crazy house job was going to be. Like it starts off crazy and gets crazier, you get. So medical school like definitely did not prepare me for that at all.
Okay. So like what was one thing that you wish you knew before you started house job? One thing you wish you knew before you started house job.
One thing I wish I knew before I started house job. I think having a constant reminder that house job was going to end. Like I knew it was going to end.
I went to counting down. Everybody counting down. Like
at some point it was no, I was not. At some point I was not really counting down. I was like, Jesus, will this thing ever finish? I think it's because of how I started in between. Like I had people that already started, that were already moving.
Yes,
so it just felt like I really had it. It always felt like there was a long way to go. So I wish I just like realized from the beginning that something that has beginning definitely finish. It's like it will end.
It will end. Okay, so what was your biggest culture shock or like your biggest shock when you say house job?
My biggest shock when I think the calls. Like the calls, like 24-hour calls, even just normal 16-hour calls. Like so I was supposed to be available and working hard from morning till night. Like and come to work the next day. Like I'm supposed to finish call. Sometimes I don't even get the opportunity to go and freshen up. I'll just start working the next day. Like I was not ready for that at all.
That was your biggest shock. Okay. So at what point did you start preparing for house job? Like was it after medical school in 500 level, or did you just not prepare at all? Like your mind you're like, okay, after medical school, anywhere I find myself, I'll go there. Okay,
no, now like at least from 500 level, we started thinking about house job is the next thing after medical school. Where would you love to go for house job and the rest? So like by 50, I was really thinking about it. But not just like just think about it then you're no longer thinking about it. But by final year, I was like, the next thing after passing final MB is actually house job. So the thought was more with me than before.
Not again. My 500 level. Yes, everybody already thought. No, let us not say everybody because I think it's different. People are sometimes never thinking about house job now. Some people usually like to think about things when they are like in that thing, like when it's in their face, which is a very like a wrong approach to things. I really think because at that point you're like there's more pressure. It's not that you like begin to think about things like before you get to that point. So January 2024, I already knew that okay, this is the year I become a doctor. Where do I want to do my housemanship? So I already had places in mind. She gets I had places in mind. Obviously, Abuja was like the top one of the top places I wanted to go for house job. And the funny thing was that Baba, that was like not even I was never looking at Baba. Yeah, so it was like National Hospital or like Jabi. Then I now prayed about it, and after praying about it, I don't know how to explain it when I just felt like I'm not meant to go to National Hospital or FMC. Like just somewhere in my mind, I just knew that these were not like the places. I cannot like it was like there was no like, you know how I'm about to say very funny. You know how they say when you want to pass by now need and you feel like give something like that. Like so just not giving at that point. Like all those places were not giving. So I was just like oh god that I mean I just googled it, bro. What I saw, I feel like all these hospitals they need to go and beef up their Google, like whatever pictures they have on Google.
So you have something better to work
because
with.
bro, like on Google it was bad. Like because I say Jesus.
Like, is this where you want to end up at?
Like I was not comparing with where I was like, let me Kokoma stay back in Parkland now. Jesus, because at that time Parkland already started like paying like in as much as no Parkland salary has always been. Or was it not?
No, it has not always been. There was a time it was lower than federal.
Okay.
But I think at the time we were about to start house job, the increment was already there.
Yes.
Yes, they were paying more than federal.
So I was like, there's no really, yes, like I could just stay back and go. But I still let me have it. I found myself in Guadalajara. So it's not about me. Yes. So back to you. How was your first day? Your first day of house job, how was it like? Were you like scared or were you just like, okay, I'm already here, we can just get it over with? Like what was your first day like?
I think for my first day, I don't think I wasn't scared on my first day.
Okay.
Largely because I said I started when my friends had already started.
Yeah.
So and I'm starting in a center where I trained.
Yeah.
So I was not in a new place. It was just like I was coming in a different capacity. Like I was not a medical student.
Yeah,
I say, oh God,
like
I'm like HO doctor. Like I know that HO is like the lowest study that but I was still a doctor. So I was not really scared. And I'm not started with ONG and I had my friend Makwa was in ONG. Shout out to Makwa. It was Makwa that was Kenny. So it was I just eased into house job. Yeah. I wasn't scared actually at all.
Oh, that's really like different people are trying to experience.
I wasn't scared.
Because for me, like I was legit like the only one from my school that was there. Like I think that I knew anybody was CMD. I said like shout out to CMD. Like I think
that's why it was
in every community in Nigeria and beyond. Because bro, like I think that was just what we did. But I had comfort. Like shout out to comfort. Comfort really helped. Like comfort really helps my life in house job. Yes, and I already had comfort because it's like the whole documentation period. I was coming from town. And town to go like 1 hour. Like, God, that whole process. I know I actually delayed my house job. Like the time I was meant to start, I delayed it like for like some like 1 week or so that I could like ease into it and all. Yeah, but having people around really makes it better because if you're the only one.
I said, like in hindsight now, I can think about the guy. Remember, I was like, people were like, "Oh, you will not have anybody." I'm like, it's not going to be that bad, but like, guy, I needed to have had people. Like, I needed to have had people, man.
Like, let's not talk about like the role of community, like in house job. Like, you really need to have people.
You need to have
really
people.
Like, even if you don't, you will. Especially if you're a 7-day member, you will definitely have somebody there. But even if you don't, you need it. Like, try to familiarize yourself with people because you need booking sheet one night. You need booking sheet. I realize that booking sheet as well. You need to call somebody to come and help you. Like, you need to like, please, do you have booking sheet? Like, you really need people. Like house job, you really need people. Like, even if you're not in the world, you need somebody to just help you and check something. Okay, help me and check this. If you don't have somebody, you start working back. Like, where you can just make one phone call and everything is sorted out. It's really need people. Like, and you really like need to make friends. Like,
yourself
already there. Like, even if you have people, but even if you have your friends, you
need to make friends. Like, you start talking to new people. Absolutely.
Yes. Like, even if you might not be tight, like so close, but a level of understanding must have been reached.
I remember one night, like I was so tired. I think I was in auto then. Jesus, I was exhausted. Then I just got to my room and like lay down on my bed. I just remembered, I was supposed to book a case for tomorrow. Guy, I wanted to run mad. I was like, I cannot move from this bed. I was just thinking like, hey, who did I see? Who did I see? Who did I see on my way? But I just remember there was a random guy, like he just said house job that I had seen. I was like, hey, well, I don't even know. I just checked the group. I think this guy's name is this. I just checked the general group and saw him and just called him. He was like, who is this? I was like, I'm sorry. I know you're busy. You're doing drugs and everything, but please, can you help me book this case? The guy was like, okay, no problem. Like, that's how he helps me. I'm serious. Like, he helps me. Like, booking, you have to book, then go to different places to pay.
And
I'm telling you,
he did
everything for me. And this was like late in the night, like 11, 12, so that the anesthetists can come and review. I was like, hi.
Like, because you really need people, like, even if it's to collect sample, maybe like it's one sample you're just meant to collect and you just left, like you have to call somebody to help you. Like, you're not about to waste transport or like use your friends to start coming back. Definitely not. Like, even food serve, like, bro, like it's not every day you cook. like you can legit count the number of times you cook. Like, you can legit count it, because when you're coming back and everything's about cooking, you're just thinking about
rest. Like, to lie down. Like, you're not going back to do any chore. You just want to sleep.
Just sleep. Yeah. So how was your first call, especially A&E call, and being the first on call too? Like, how did you feel?
I think I didn't get to experience A&E call until like my last posting. Because of how
it helps. Yes,
because medicine was my last rotation. So, and by then I'm now OG now. Like, I've gotten experience. I've done O&G, I've done pedo, I've done surgery. So like, I was now, medicine was my last posting. So it didn't help that. I would say it just helped me cushion the call back, because it was still crazy. Like, in fact, when there's something we say M-talk is the devil's call. M-talk is the devil's call, because you're going to be giving drugs. Like, you are assigned, like how it works is that you have like two words to give drugs, then you're still the doctor on call. So you're legit I'm telling you, you're legit running around to give drugs, then you still have the M-talk patients to attend to. So like, by the time you're done, Jesus, like, there's no way. Because I remember I was having a conversation with someone the other day. The person was like, I want to be actively involved with the M-talk, like to review patients, know what I'm like. Everybody wants to do this thing, but so like, you're not with me next day or yesterday. So it's not telling me that now he gets what I'm saying, that you cannot, because you're trying to, like, almost everybody in A&E is on IV medication, because they are at the point of like,
they are emergency.
You have to finish it. Like, imagine you have like 20, 30 people to give drugs, and they're like, each of them are like on 3 IV drugs. So in your head, you're just trying to meet up. They meet up with the ones you're just admitting now. So there's no time for you to. So it was still crazy, even though that it was not. I had my A&E call much later, but it was still crazy. Like, it was not like any call like I had covered before. M-talk was just crazy. Like, it was crazy.
I really think, because in Gwagwalada and UATH, we don't give drugs out of that.
Oh, yeah,
I think it really helps. Like, it really helps, because
it does.
You just, in as much as just M-talk, you're like, you have like, I think the A&E then, which is just medical A&E, is 32 bedded. But they can increase, like, when most patients I do add more people, but I think the standard was like 32 beds. Yeah, roughly that. So you know that, okay, you're in charge of all these patients and the new ones that are coming, but you're not giving drugs. Like, it's the nurses that give the drugs. But being the first on call, being the first person,
I think it actually helps that the nurses are giving drugs. I think it's something that we should actually push for in my center, because you'll be so distracted and exhausted from giving the drugs. Like even the regis, they start to complain, like, oh, like your reg can call you, how far away are you? Like, oh, you're trying to give drugs upstairs, and there's someone here that needs maybe IV insulin, like, you need to be here, and like, you need to prioritize triage. And you're like, I want to triage, but like, I'm going to spend the entire night giving drugs if I do this. So, but at the end of the day, you still have to come and meet the person that is most critical and attend to the person before going back to give drugs. So, at the end of the day, you're just very, very tired.
Do you ever have like this feeling of anxiety, like before your calls, or like before each call, you have like this?
Before each call, like,
is it panic attack?
Yes.
Or
I think I always had that before every call. Like, there's this, like, once I'm on call,
very normal thing.
Yes. Like, once I'm on call, I'm like, oh God, please. It's like, once my heart is beating for, like, Jesus, please, God, I don't have, like, I actually hate calls. Jesus. I don't know how to do clinical medicine when I hate the concept of calls. Like, I'm pro abolish calls. I hate calls. So whenever I'm on call, but I'm like, Jesus. That's why no matter how stress-free a call is, it's still a call for me. Like,
still a call.
like the next day I go back and I'm tired.
You do not get sleep like on your bed, and like the whole emotional and mental stress. Even if no patients came,
even if you didn't get called, like that's like your mind is like, oh, maybe someone will call me. Maybe the nurse said they need something. Like you're just there's no peace, man.
No peace, so.
Like I just like that anxiety is always there until it's 8 a.m. the next day. I'm like we're done.
And you know as they say, a calm call is like retrospective diagnosis.
Retrospective like mad.
You know, you finish that
by 7 a.m. so since this up.
Hey. After this experience, about
7 a.m.
7:30 twins. Twins. Just be
like, no, you can't even say.
And you know, like this type of thing can just like once they come, it's 7:30, like they cannot even almost like casualty of it, they will not collect that patient. So you just have to, and to stabilize for them to go out, it's like, you just like you spend like and that time, maybe like you're not leaving like by 9, by 10,
yes.
And you just have to like just go straight to ward round. Because I know people usually think, I don't know, you know in America like they do shifts, even nurses do shifts. You know that nurses will do. You know this that nurses do that maybe you legit stays for 24 hours. Now you're seeing 3 sets of nurses. Then this nurse is now coming to call you and say, oh my god, this you just be trying to make her understand like I
legit used to say it though. I legit used to say
you just
came. Like I've been here since. Like I've watched you change. First person, second person, third person. You cannot come on because most times you just entered, like you just came, you just changed, and you're like, dog. I'm like, sorry. Like I would legit even speak Igbo so that you understand. You say, I don't remember things. Yeah, just come. Just let me breathe. Just let me breathe. I will attend to that thing you're saying, but just calm down. Let me just.
I remember my 48 hours, like my first 48 hours, like O&G. Because but now they have scrapped it, they just do 24 hours now. Then O&G, once your weekend call.
Is crazy,
like once your weekend call, and we do our O&G calls, like team calls.
Okay.
Yeah, so MFE, there's Maternal Fetal, there's your guy, like, it's the team that will be on call. So, even once you're on call Saturday, you're on call Sunday, so it's Saturday and Sunday. And then Monday, you just enter work. Like, very crazy, like, very crazy. Like I remember my first call, I could not believe, and that was my first week. Like my first week, my first week. I said on Monday, Tuesday I was on call, and that was like 31st. So I first was on call. Then that weekend I was just on call. So I did Saturday and Sunday call, bro. Like crazy stuff. Like crazy stuff. I know about this. You expect the person to be like at their A game. Like you did Saturday on call on Saturday, on call on Sunday. On Monday, you have to go for morning meeting. Like, you know, the regis are not on hot seats. You don't be like,
as if you are finished sleeping in your house and you want to come and ask somebody that.
You don't be like expecting the person to bring. Okay, they ask you, okay, what is PPA, postpartum hemorrhage? They want you to say it like word for word. I'm like, how? This person is barely in that place. Like, this person just wants to. I know O&G calls. You see, emergency. I know O&G calls are like when they say emergency, O&G like. They are the kings of emergency.
Like like they actually know how to handle emergency.
Yeah,
like, they call emergency.
Bro, like when you see PPH, bro, you have to handle that bed and do this. But that woman is like in front of you.
I say it's a dire emergency.
Like
around. Like the legit used to do that. Like I'm so grateful I stayed with O&G. Like because O&G was also my first. Like I think in my center, starting with O&G, like I would even advise if you had an opportunity to choose where you start
from O&G.
Yeah, like if I had the opportunity now to choose now because it helps. Either you start from O&G, maybe you start from. It's just like if you start from PDO, they can just first day you can just put you in NICU. Like you just do pilot. Next thing you're doing. But O&G, you will learn how to like. That's how you learn how to really prime for the work, like for the job. Yes, you learn how to set line, like secure IV. You learn like there's all those small things, and they like the inclusivity is actually very very loud. Like you actually feel like a doctor. Like they involve you. Like it was the O&G that I knew that like the first day like. Someone is telling me, when you come, you do pre-rounds, you see your patients. If it's SVD, after 24 hours, you can discharge. I'm like, I can discharge the patients. Like that's how they expect you to be responsible for your patients. So I think I started the call because the call can just like
really crazy,
like from zero.
I think one that had like PPH. She has had this like career section before, and then she went to this professional vet attendant.
Right.
They gave this one oxytocin. Like, why are you augmenting? Like, What are you
just need a rupture?
Yes, what are you argumenting for, bro? This one came in white. Like, why that? We didn't even bother setting the line. But SRs, like, they were looking for, because, bro, like, I put let me sure. I was already going. Like, I know how many points of blood that may give this woman. Like, 8.
So a massive blood transfusion.
Bro, like, you see yourself, because HU at this point, just you and blood bank. Just in the theater. Is you and blood bank. Like, bro, like, the amount of times I went to blood bank that night. Brian had to start praying. Like, I was like, I was being in tongues throughout that. I say, this one cannot die. I know the funny thing was that I was telling her patient and the relatives, like, this is like, they're just dragging, like, say, well, not what happened. I'm like,
why did you now bring her here?
Pissed. I'm like, can't you like hasting up? They're just acting nonchalant, laughing. I'm like, this woman is about to die. Like, she is legit about to die. Like, imagine even if HO had to donate blood for this woman. Like, I have to, like, both of us have to go donate blood. And you know, it's like fresh blood. So even beg blood bank, so you collect that fresh blood. Those are like, mago, bro. But ONG sha.
Like, you deserve their flowers.
Like, currently, I think ONG is still one of my, especially the unit I was in, MFU, like, they had the best people.
And the thing that, like, I almost did not enter that unit because when I was signing, I wanted to do I wanted to go to my friend's unit. I wanted to go join Mama's unit. So, like, so I'll be with Mama. So the red started, I mean the SR, they just looked at me and said, no, I'll put it in our unit. Like, in his unit, I'll put it in my unit. Like, I don't know whether to feel sad or to cry. I was like, okay, now. Like, I cannot even beg. I'm already begging. I think, I'll put it in my unit. Like, no matter. But that was like the best unit ever. Like, workload was minimal. The teachers were so chill.
MFU had like the worst workload.
I know.
That's why people usually run away from MFU, because maternal-fetal was like, that's the whole point of ONG. Like, pregnant women, so like we had like the highest workload. But you see the people you're working with.
Yeah.
So chill. Like, that's what as yes, they'll tell you, like, if you act funny, they'll put you set you straight. I like that one. Well, you know that, you know, it's like really chill. Dr. Issa, Dr. Rabi, Dr. Zaman, like, really chill people. Like, what I mean, really chill people. Like, they're like really chill. And those I was working with too.
I think that makes it different. Like, so if you work with crazy people in house job, like, you suffer like
man. What was the worst unit in house job?
Worst unit.
Yeah. Okay. Or worst posting.
Okay, I would say I would say orthopedics. I'm so sorry. Shout out to my surgery guys. I love you people, but orthopedics. So, and I think I don't think it's the unit per se, because everybody in the unit was very chill. Yeah. But I think it's when I did the orthopedics, like, I did auto posting during the time when there was strike. Like, Joyce was on strike, so National Orthopedic wasn't working. PNTH, like, so the burden was on us. So we had a lot of patients. Like, like, so it was just no. It was just very crazy that period. And I think that was when being in auto gave me like my worst house job experiences. So I think that's like why I just crowned it my worst unit to be in house job, because I had a lot of things happening in auto. Like, I had days where I was so exhausted, like, I don't want to. Because when I say house job, I was like, I'm going to try it, because the best way to learn during house job is to, like, you're seeing these cases, you're going back to read, consolidate stuff, and you make a better doctor and the rest. So ONG, I was very like up and up.
Yeah, actually, I read more in ONG. It was my first post. I read more in ONG.
I was like morning reviews. I'm taking notes, they're asking questions, you're learning. Then when it's over to pedo, like, pedo was still good. I was still trying to learn. So sometimes I try to like Dr. Alex be like, shout out to Dr. Alex. See that patient you are giving drugs, what's wrong with that patient? I'm like, I'm not gonna try to find out what's wrong with the patient, you get. So it just helps me. Then when I entered surgery, initially, like, I was trying to, by the time I got to that October, it was basically like it was me trying to stay afloat. Like, I didn't know it was that bad until that round. It was consultants for drown. This man legit asked me like how many questions that day, and I was like, I didn't know how you be saying you don't know and you're feeling sad. I was unapologetic, like, sir, I want to go home. Like, I just need my bed. Like, this thing you're saying now, I even thought that maybe he would consider me and say, EJ.
You're like, okay, my
me. I said, yeah. The man said, okay. That he asked me one more question. I should better get it to that. I trained here, right? I think that was that. I think this is something that is very dicey, because these people are your teachers. Like, because I did my house job where I trained. They were just like, I taught you this thing now. So you're like, Yes, you did. So they are trying to remember what they taught. I think it was my consultant in internal medicine that kept doing this thing to me. Like, hey, I used to tell you this thing in class. I'll not be trying to rack my head. Okay, sometimes I remember, sometimes I don't. So that this particular one, I remember. I just answered it. Then we just continued the rounds. Like, I did not just finish saying that I was about to die. So no. I think it was even in that auto. Yeah, it was in auto that like my patient's relatives like verbally assaulted me, said like the meanest things to me. So I'm forgiving them in case because this world is very tiny. When they will see this video now, I think I'm keeping a grudge, like my love. But that day was not the best day. Like I won't because I'm forgiving them doesn't mean I should cancel out that memory now. Like it was still like very it taught me like it just made me remember. You know how like one of the advice against you say patient relatives are not your friends. Like even you as a patient relative, you're not your fellow doctor's friend. Like do you get like no matter how we want to look at it, sometimes we can be more understanding as we're doctors with our fellow doctors, but at the end of the day, emotions are involved. Like this person that is sick is your person, so you're going to be biased in a very like on an emotional level. You're going to want some certain things that you know that if the table were turned, you won't be able to give this thing that you are asking your fellow doctor for. So either way, whether you're the patient relative or you're working with a patient relative, you guys are not friends. Like you guys are not friends. So I just because these people were like people that like I'd already like established like I'd overstepped actually like because I try to keep a healthy boundary.
Yeah.
Like there's no if I know say you're being overly so yeah, okay, this is time to draw back. But this time around I was like because they were young and I was just giving them everything that they wanted. So when things just start working out the way they didn't want, I was like, these people just like to the point that somebody even had I think you know and had to go to the theater and tell my consultant that people were yelling at like some people were saying something to like my consultant was very angry like said they're not going to do the case until like they write later to apologize and the rest. So which they did and everything, but that day just really really drained because I think I even had a family member that came to see me, but I couldn't even go to see him because we were very busy in the theater. So I just came back, just sat down. I was even hungry. I think it was my friend and I brought food for me. I was so Jesus, I cried, man. I cried. I was like, nah, I don't think I can do this medicine. I don't think I can do this.
I think we all come to that point. Like everybody comes to that. I feel like bro, like once you do house job, you must get to that point where you just like I'm not doing this again. Like,
that's why I think it's important to do house job.
And I think you should even get to that point. Because it will help you know, okay, this decision I made my full chest. I've seen the worst.
It's informed. You make
very informed decision. Yes. It's really important to get to that. Like really, really important. If you know I'm doing clinical medicine,
you know that yes. You've weighed it. The pros and cons. This is what. If you say you don't want to do, you know you have solid reason why you don't want to do.
Actually, I got to this point like a lot of time. Like the clearest time when I got to this point was on M Talk. We usually do because if you're on call on Friday, but those the patients Friday, Saturday, Sunday, Monday. That patient is your patient. Till we can hand over to like the respective units. So I was on call on a Friday and I had this patient CKD.
Please, you guys should be drinking water. Stay hydrated, guys. Stay hydrated so that your kidneys will love you and stay longer for
like nephro patients are like the most I don't know the word to use now.
Like I did nephro for 3 months, so don't worry.
I guess nephrology not really like your worst unit. No, it was usually being people's worst unit.
It wasn't my worst unit. I think it was because of the people I worked with.
Wow, that's really. I think I wasn't expecting it to but now you say okay. Yeah, no,
yes, like I cannot bring the both of them together. I'm telling you, like nephro,
workload is crazy.
Yes, the workload of nephro was crazy. Jesus, like we had a lot of fish. Everybody knew because like when everybody knew like I was going through a lot of nephro, but I think what just like helped me was because of the people I was working with, my seniors. Like they were very chill. Like I had like really chill from my SR to my reg to the house officer I was working with. Like also like helps me like shoulder the burden of nephro, so it didn't feel that bad.
So when this patient was like it's non-CKD patient or maintenance dialysis, but stopped because of financial constraints, and it was really like in complication, urinary gastritis, like was legit vomiting, like hyperkalemia, like potassium was rising and all. I know this is just dialysis can just like instantly solve the problem. And like this is
like magic.
Dialysis prescription done this because as far as the man did not want to dialyze. But like I've already cancelled this patient. He's already like his game, the wife, everybody's game. Then it's not like to get space in dialysis unit. But I went there. I kept going, and this was not my call. I was like, this this is weekend when I'm meant to be like resting.
So you're doing extra.
I'm not doing extra. Like, because of my conscience, I know these patients, like, they're under my care. So I was coming. And then the patients of other people, that also can bring that call. They're seeing me now. They're like, okay, this, I have. So I was now like, time I'm meant to use to rest. I was now, like, when things are not working, it's a point to reach, like, an elastic limit. I think I wanted to break my arm, like, now, but I just kept everything back. I just told the person on call that there's this patient, and I just left. I just left.
How is that? We should know when to stop.
Like,
you know when you're tired, when you reach that point.
Just know when you've reached that point when.
I think I used to give my own from my mood now. I start off strong, like when my call starts, I'm very kind, I'm very polite, like I try to treat my patients with like I can't even sometimes I can't even sort your drugs. Like I can come now and everything is mixed together. There's the tablets, the IV, and I know that I'm interested. Doctors on call, we're interested in the IV because it's, I'll think to bring like another sheet. I'll divide it. This one, give this one to the nurses, give this one. I can be like that at the beginning of a call. But as the call progresses, you see me like next thing I'm no longer trying to be kind. I'm now just nice. Like, okay, no problem. I'll just give you a few times. But once I just notice that my temper is I'm becoming short tempered, I just know the time to move has come. Like the time to leave this place is approaching. Like I'll just know that like when I start being very snappy, like no. Like I when I'm not patient enough to explain something I would normally explain, I'll just know that I'm actually like really tired and I should go. If not, I'm going to get into an accident. I'm going to either injure myself or maybe give someone, like I'm not able to give my best. So I'll just
this has happened to me. Like my first week, like I was tired from this call, but obviously patient. Oh, doctor, there's this sample to take this. I was like, okay, let me just take it. Let me just take it. Like, and I went to take it and I put myself. So I just I just kept the needle. I just kept it. I just took the blood. That blood I just took. I just carried it straight to the lab to just test to know whether this patient is positive or. I feel like I felt like the patient was not going to be positive, like somewhere in my mind. So I just checked, it was negative. I just carried myself from that lab to my room. I didn't even go back to A&E to do anything.
Like, you have no business going back to this.
The other patients, I didn't even go back to do anything because there was nothing I could do at that point. Like
you just need to
absolutely
rest.
Nothing. Like I just
need to rest, man.
Once if I kept working at that rate. And the funny thing is that if I now maybe did something to that patient, but that patient like can slap me.
Yes, my patient will not be able to forgive you.
You know, like consider that. Oh yes,
I've been
working. They always bring it back to the doctor's fault. Like, okay, doctor should show more compassion. I'm like,
so your response, even when you're a random person on the street that is not showing compassion, you now start hitting the person. Like your response is to hit a random person that you don't even know from Adam. Like, your response is to hit the person. Like hitting the person does not make the person extra compassionate or anything. Like the person can't even help you again. Like the person can't help you. Like you just hit, like you are the point of, I don't think people even understand that. And at the point where someone is, maybe they'll say, oh, maybe we're now having God complex. We feel like we're the only ones. But yeah, the point where this person is like your solution right now. Your helper. How can you be beating your helper? Like you want your doctor to
just run it. Like that's the thing. This person, you just be this. Doctor just like just run like. Because why are you? Everybody's just scared of you automatically. Everybody just.
Especially so like because me, if I try to like once I get to that point where I'm like I know that I'm snappy, and if I don't leave or if I try to or maybe try to do extra stuff like because sometimes I'm about to walk away, I'm like, oh, you can actually just pass that catheter before you leave. I'm like, go. You can actually. Well, I'm just telling myself, you cannot just go in. So like I have to like force myself to leave. If not, like I remember one time there was one patient like that. Like my grandma wasn't feeling fine, so she was on admission. So I was working for my unit. I was trying to take care of my personal stuff. So my unit people understood. So they tried not to. They even let me know. Like they allowed me. They said, "Oh, don't come for clinic. Just take care of your grandma." So I was taking care of my grandma. Then because I was on the ward, they now told me to, oh please, there's a patient. We just need you to pass a message across and the rest. I said okay. I finished. They told me to check an investigation result, make this inference, and tell them this if this is what you see. I said okay. I went finished checking, and told the woman. The woman that said the patient really says is a doctor. In quote. I said okay. I finished explaining everything. So I think that maybe this person understand that's what my colleague. She said no, that I should follow her so that I'll go to the clinic. So that my consultant has called me. I'll be my SR, sorry, has called me and explained this thing to me. And that's what I'm explaining to you. She said I should still raising her voice. So I was just like Nadia. I was just trying to be calm, like okay. I finished explaining again the second time, I think the third time again. She just full like this like you're walking me and someone is just walking. was like, madam, what's the problem? Then I just screamed. I said, I'm tired.
Bro.
I said, everybody was just looking. I said, I'm tired. I'm done explaining to you. Don't follow me. I'm not working today. Don't follow. Because I think I don't even. You know, after shouting and said that she should not follow me. I was like, I go. I went and met my dad and sat down. You know how woman came to my grandma's side. She came and said all this. Hello, good afternoon. Good afternoon. I was like, madam, excuse us. Like, this one is now like, yeah, now
like personal.
I swear,
like,
you've invaded my privacy. I said, ma, please excuse us. Like, I told you I'm not working today. Like, I've done my due diligence for you, and you still don't want to, like, go back to the clinic and get somebody else to do this stuff for you. She said, like, that was the, like, I respected my father, so my father didn't even say, like, he didn't, because he didn't understand what was happening, but he just trusted that I should handle whatever it is, so he just kept quiet. I was just sitting down by his mom's bedside. So, she just said, why would I be talking to her like that? I said, madam, I told the nurse, please, you know, you are the ones that have the word. She tell this one to leave this place. The nurse said, madam, she ran me, look. That's how she left. Like, I was just, man.
I really feel like it's a skill. Like, know when to, you know how they say, refer. You need to know when something is just, you can't handle it.
Yeah, it's beyond you,
It's beyond you. I don't mean like, oh, maybe the diagnosis. I mean, like, you cannot handle this thing at this point. Like, you're now tired. Like, just know when to just, like, excuse yourself from that place. Like, because, you know, it feels like, okay, doctors, you have to give, you don't have any right to be tired. You have to give your all. Even when you're tired, you have to, but people feel like it's something called diminishing return. Like, when you're tired, you cannot expect the same, like, you cannot expect the same type of care.
I know that definitely nobody is saying, oh, maybe if you're tired, you should just abandon the patient and go, because we have to bring, because nobody likes to, like, get something like the way they want to hear it. Because now this person, you've started giving care to this person, so this person is like largely stable. This person is stable. You just want to get yourself before you're the next person on the bed. Before they start turning to you too as the patient. Like, I used to really appreciate people that understand the concept of teamwork. Like, we are all a team. Like, there's nobody that is against anybody. We're just a team. Like, put the porter, like, put water in the call room, Buddha, for crying out loud. Is your work. I should not beg you. Like, you're going to make me work better. Like, I'll be able to sleep in the call room. I'll be able to use the restroom.
Really, like, everybody knowing this is what they are meant to do, especially like nurses.
Yes, the porters. Like, even everybody should just know what they are supposed to do
and just do it. Because sometimes porters feel like, oh, maybe doctors are now, because of their doctors, like, it's not even it, or nurses. I'm like, that's not even that's not even the point. I'm not get the point is that we all need to do this thing together, so we can reach like this common good. It's not about, okay, I'm the senior. Like nobody.
I think what now helps me, but when I understood that this was how the system was, and you have to find a way to make it work for you, and I decided to build my own like relationship with this people. I said, my God was on the house job. Like, I legit remember one day one girl came for pilot's call, and so go to her, I'll make her watch this video. So like that I came, I was the one on them talk. So I was just came in. I just like before we left that casualty room to go upstairs, I hugged like 4 nurses on my way. I don't just greet them. I was like, "Nursey, this one, oh, go on them," because somehow I've tried to like when I come into a room now, like come to the nursing station, like I try to gauge, especially when I'm on call, because I want to like I want to go and sleep in my room. Like, I don't want to sleep in that room. So I try to gauge the nurses I'm working with. Like, when I greet, you know how you come, I'll try to like greet you very like excited. You're this, see how are you now? If the person returns the energy, okay, this person is chill. Or maybe the person does not, but you know that this person is indifferent. But this type of mean energy you get, you just know that this is someone you should be careful for. Like, this, you just I'm not expecting this person ask you, are you on afternoon or at night? Person will be like afternoon, like okay. Just carry yourself and go home. She get like sometimes I even like legit pray and ask God that let's be my favorite people that are on night shift, so that we'll just have a calm night. She get. So then we thought, as I said, June. I think who even gave me this clue? I think either Stanley or Chuba that gave me that. Actually, this Ezibo. Oh hey. Yes. You know, say, the person just smile. Okay, you person just do what you want them to do. Like, person legit like. You tell somebody to go and bring something now. Person go and miss, but the people that do not agree, like maybe I'm on call, I'm supposed to go and collect call food. Before I even come finish giving, they've gone to go and collect food. Like the man has gone to bring call food for me. Because once we see each other anyway, even if I see him, like I'm not on call, I see him. Sometimes he will not even see me. I'll just say, we'll just wave. Say it's okay. Like that relationship I had to start building with these people, pharmacy people. Those pharmacy guys. Like I think it's just
you need to really build relationship.
Yes.
And it's not like doctor, like across all sector, like doctor, nurse,
especially with those people are not doctors.
lab. Hey, you're not an extrovert or more. You're not an extrovert, not even for medicine.
It's not like I realized, call, yeah. Like
I realized that. Hey God.
Because to be a doctor, like you are going to take on so many responsibilities, so many roles, like
so many roles, like, even the patient relative. As much as yes, there should be like a professional, but you need to even maybe like it's some easing in and all you have to do as a doctor. So if you're really uptight, you go hard.
You go hard for you all around.
You go hard for you, like mad. Like
you see, that's the difference. Like, some people actually don't care. They just want to do their work, but you can actually do your work and have like job satisfaction. Like you just like you're not trying to make anybody feel like it, but you're just satisfied. Like, oh, well done, good job. Like they're not even telling you're telling yourself like, okay, after you like, okay, you do not just guy, you just a labor. Like you just strive. Like something that would have just come easy for you. You just like just imagine now you come now and maybe you say, oh yeah, these nurses you don't care about. Like I've seen people like nurses I'm chill with. Like the person is coming and the person say, this no you know say no, the problem is you. Like I actually tell you, I say it's you. Like I can guess that maybe the person is in a bad mood that day, but man is sure. Like you can start insisting. There's some things that you just have to let go. Yes, just leave it.
You know that patient. That's if you lost any patient. Like if you lost any patient, how did you handle like losing a patient?
Okay, I think losing a patient for one, like for the 1 year I did house job, I lost patients, so but I didn't really lose any patients like on my shift.
Okay.
Until like the second to the last week of house job. Like that was my first time to find a patient. You get, so most times I was never really involved. Like either I'm coming to take over a call and they say, oh, patient fact, I'm like, oh, okay. Or maybe I come and say, oh, now my patient died. I'm like, try, okay. So I did not really like have any like I was not really, it didn't affect me emotionally. I was like, try, sad stuff. But I see that night came for M-Talk. In peace, M-Talk just started. It was like 7 p.m. No, like M-Talk, like MTOC. It just started. Like it was like 7 p.m. Like so that was like when I started to give my 9 medication. One man just said gas, I was like, hi. I was like, okay, this is not the night to do this to me. I'm almost done. Please, just stay alive. Man just next time start doing CPR. CPR. I just knew that. I don't know about your center. Like you could do CPR and the person comes back.
Most times it's children, it's babies.
Yeah, like for adults, I don't know. I think babies are very resilient. Like they somehow always come back.
That CPR, asthma. That's what.
Okay, and adult, the person
I came back. Everybody used to talk about it. Like they say it's only asthma that this CPR, and that person came.
I've never experienced it. Like I've not experienced. Like once you start CPR, I know like nurses love for. They say go and give hydrocodone. I'm like, does that really help?
Nurses like they used to tell you guys, just look for it. It has lines on.
Like most times it doesn't actually like do so much, but like they just want to give it. So when you just said CPR, I was like, hi, next thing that patient just sat down. Like I was very sad. Like it's like hi. Like at some point I even had to remind. I was like, I had to like, all this. I'm trying to like be in touch with my emotions. Like, why am I sad? Am I sad that this patient like I'm sad that my streak has broken, or whether it's my fault? Like, is it because I not do well? Is it something that I was just trying to say? I was like, God. So I just somehow I got over it.
And she was just starting.
Yeah, but she was just starting. Then then the next person died by 7:30 a.m.
That's him.
As my shift was about to end, I was like, this night. Like, my even started me story. Because I have a very cute friend. She just started this story. Like, hey, I should certify this one. Like, all this, like, so that, because that thing really weighed me down. Like, I was like, hi, like, but every other person I was just laughing at me. As for like, which one is that? Finish out the not certified patient. I'm not even serious. I'm like, it's not about.
I know that did not do.
It's possible to do that.
Very, very possible.
It's possible to do that. Like, it's possible to, because I was almost done. This was like last week, and this thing was happening. So I was like, okay, no wala. Well, I think the closest I felt like losing a patient was day before yesterday. It's a patient we've been managing. She came in. She was referred to our center. Like she gave birth. I think she had obstructed labor, so she had CS, emergency CS. Then she now had AKI, so they invited us nephrology to come and see. We just managed. The woman just kept things just kept happening to her. She was dialyzed, for like maybe 5 to 6 times. Things just kept happening to her. And she's very like when she's good, she's good. Like you come in and she's very happy. She's like, she feels really good today. She's better. She's all moisturized and everything. She's looking when she's bad, she's like telling the doc like she doesn't understand what's going on. So it was just like good days, bad days, good days. And I remember the last conversation I had with her, like on my last day before I went on my terminal leave, she told me that in this life temptations will come for people. Like she believes that this is her own like trial and tribulation that has come, that has befallen her, and she has to bear her own. Everybody's bear like we might not know what someone is going through, but she feels like this is what she has to go through because it was her first child. Like it was her first pregnancy, you get. So like she feels like that was the conversation we just finished. I was like, that should not worry, that everything is going to be fine. Like she's getting the best care. Like everybody's seeing her, urology is seeing her, nephrology is seeing her, orange people. So only for me, one night I was sleeping. Someone called me. How are you? You to nephrology? I was like, I'm not in nephrology anymore. But what's up? Person said, okay, the thing is that call my second or call the reg. My name is the person now called. I thought I slept back now. I thought everything because I told the person, if you don't reach them, call me back. But the person called me back. So I was like, maybe everything is good. Then for me to wake up the next day, the first message I'm seeing on my phone, my friend texted me that the man died this morning. Like I felt really bad. Like I did not cry because like I felt so bad. Like I think like that's the closest. Like I felt very like the entire morning. Like this like maybe like even after I forgot that maybe I got that message, I was just down. Like they asked me what's wrong. I was like nothing, but I was just down. Like, I couldn't get myself. I just knew that it was because I was just thinking about everything she said, how her life just like even the way her husband was very supportive, her siblings, her mom, like they were just turning up. Like she just I know that this I think she had a PA or something, that sudden breathlessness that just steals someone like person like I felt really bad. I felt really bad, really, really, really bad. Like I was just thankful that I didn't have to go to work because I was only like because I was just
because that's the funny thing. The funny thing, you can certify a patient now, and then the next you have to see the next person.
yes,
like
no.
you just have to move on, like just immediately.
Yes, no.
Just continue then. I'll just be checking it. No. So you started with you gave the patient drug, the neighbor was gasping.
So I just finished giving because I started giving drugs. Then I just finished giving this man drug now. The neighbor, like the justice and just next, saying gasping, Hey, it's like what's going on? Said CPR, like that was the point that this realized. They say just the person's ribs will break. I was like, so this man, I was just doing after everything. Like the man just by the time it was time to certify, just checked. There was no respiratory effort. It was delicate and fixed. Nothing was. The man was, and you know how like the patient relatives are just around you, like the cry is just worrying. Like everybody saying, God please. And at the time they had paid. They sent a pastor money, 1.3 million to pray.
Are you serious?
I swear.
That's great.
They made deposit of 1.3 million naira for a man of God to be praying for them. Like they just sent, I think they sent part payment, they not sent the complete one. Then this is happening. So a lot of things, like people were saying different things, and we were just, and at that point, I don't know, for myself, I can't really say, you should go outside. They will not be asking what do you want to do for their person that they are telling them. So then I just noticed, because I just told I just looked at the nurse, I told the nurse that this man, there's nothing here again. The nurse just told me no Allah. She not just told me I should look for. We just spoke. We did not talk, but I heard what she said. So she continued the CPR. Right? I was looking for the most stable patient relative, like who is more like who I can actually have a conversation with. So the man's son, like I just told him to please come out. I took him away from the chaos and just broke the news to him. So like I can't remember what I said, but I just know he asked me come to where. Like I did not have like this is someone's father. Like his kids were there, his wife was there, and just like that, like I had to just empathize with them for a little while because I knew that I had to document and continue giving drugs to the next patient. So I didn't even have time to sit
and like process what you just did.
There's no time for that. Like there's no time for that. I just continued doing my stuff. Yeah,
I think that's really crazy, Sha.
It's crazy. Yeah.
That's really crazy. I can remember there's one of my class team calls. We lost a patient. That's 70 degrees. So she has really like stayed like for like 2 weeks. So hope like because if you just like maybe like the next day, you already know this was bad prognosis, like bad prognosis. So your heart, you're already like prepared yourself in a way if this happens. Okay. But this person has really gone like making a lot of progress. So you're like, okay, this can be it. Then during my call, I was just about to transfuse him. Like I'd already got the blood. And then I was now going. The one that just ran, I was in the nurse station trying to like document and all. And the one that just ran and starts was saying that he's not moving, he's not. I was like, God. I was just like, God, I beg. I went there. And this was like this bond, like you don't even know where to talk. Like I did CPR, did everything. Called Mary. Mary just told me it's fine. Cause from my, like I was not Mary already knew that it was already getting to me. Mary told me, don't worry, it's not like don't think about it so much. Yeah. Just leave it. I just go to the room and all. Cause I'm Mary just finishing this person. Like we just cause there was a new patient beside, so we just saw the new patient. We saw him. Mary was also happy, like bro, everybody like you this medicine, like has passed that hope and all. So when it not happened, it was just I felt terrible. Like I felt so bad that night.
Can be crazy.
Like, I felt so bad. I just went back to my room and I just stayed.
Can be crazy.
Like it's just crazy. Like what you just see this person to the person is doing.
Okay. I think there's nothing that will bring it to your consciousness that life is just perfect.
As being a doctor. Like it's a really sad. It's a really sad.
I think it does a lot. Like
it does a lot to your mental health. Yeah. Like, it does a lot because it really does a lot.
You know that sometimes I'm like, oh, thank God I still like. Sometimes like when I feel like I'm like, thank God though. Like, because there's some days like I've heard that, or maybe something I'm like, okay, I'm moving on. Like I'm not even like I don't feel bad. Like sometimes I'm talking to my parents and like I can see their face, like how heavy this thing is. I'm saying something so heavy, but it does not even feel like I've somehow pushed past. Like I can't bear this way. Like no, I refuse to bear it.
That's a very valid point because you know this is something you just push it.
Yes, I refuse to bear that.
You cannot bear this weight and bear this weight.
I cannot
bear all the weight, so you just keep it.
I refuse to bear it.
It's really dicey because you can get to the point where you don't now care. Like I see somebody crying, just be like, like
you'll be fine. You'll be fine
and just move on. But at that point, maybe just tell the person sorry. Or so the whole
show extra empathy.
So you really need to protect yourself. Like you really need to protect yourself as a doctor. Like especially as a young doctor, you're just starting. Protect yourself emotionally, mentally, because you will meet toxic things.
I swear, and I feel like at that point you're like sponge. You're just absorbing things. Like I think at the end of the day, that's what's going to fall.
Yes,
doctor.
Exactly. So you have to really protect yourself. Whatever they are saying, just keep it one side. And the funny thing is that this toxicity thing, because you're in the system, like the chances that you become toxic are really high. But this is what you're used to. So you have to protect yourself in that system, knowing that okay, I don't want to become this type of doctor.
Yes, actually.
And make active steps, not being even with your fellow HOs, because there's one way you'll be moving. People that when this person comes, they say
I see that HOs used to be toxic. I don't know if this is.
It doesn't make sense why HOs will be toxic.
Like how do you be acting like one? Is this particular? Guys, also I have no business being toxic. Why are you? So she was when the nursing station, different house officers were trying to know what everybody's trying to scam all this. Give me this folder, please give me this folder. Everybody trying to prepare pre-round stuff so that when your chief calls, you say, oh, you're already ready. Then she just comes and she's like, give me that. Like she was not talking to me, she was talking to a new house officer. So she was like, give me that folder. The house officer announced, oh, you know how you already know that person did that thing out of the person thinks this person is a red or an SR. So she just did it. I was like, she's a house officer. So the new house officer just, am I serious? She's a house officer now. So the girl that was doing that thing, she was still maintaining her mean face, her mean energy. But I have to say that straight, this is your fellow house officer. Because even if we're doing seniority, which doesn't even make sense, on that table, even that person I'm saying, oh, is Jean, I stayed house job before her.
Yeah.
So she was not even my badge. So there was no need for her to have treated that person the way she treated the person. So she was like, I'm like, she's a house officer. Which can tell me that? Don't give her anything. She should take the folder. She wants to take it. So actually, some people, so you can imagine this person is really like that. You can imagine what the person will be as a reg now. That's it also helps to find someone when you see a doctor, there's some doctors you see and say, this type of doctor I want to be.
Yeah.
It actually helps that you have something in mind, like you have examples that you are actively looking at. Like it helps that you are looking at something. Like it further distracts you from seeing the obvious flaws around you. And I think to also bring balance to it, you also have to remember that this person you're looking at is also still human.
Yeah, this person
and
make mistakes.
yes, exactly. So that when that thing happens, you don't say, oh, everybody's still the same at the end of the day. But no, you just know that on a scale, this person is one of the good guys.
I remember like one of my first times in MTalk. It was something I wanted to take. You know Dr. Alex Etobi?
Yes.
He's a consultant cardiologist, but he was like, I think he was in AIE. Yes, he was like in AIE that time. Maybe he's still in AIE currently. So I was trying to take the sample. Now just told me I should be real close. He took the sample for me. Like I was shocked, like because I was really fidgeting, like Jesus, not impressed this person, because we really have relationship. That is totally really have relationship, like outside this thing. So this somebody you respect.
Yeah.
You to see that. But at that point, like when he just like told me I should be close now, he just took the sample and I was like, he really did something to my brain. Like I was like, this can actually happen. Like it can actually happen, because maybe somebody can just come and start shouting at you like, come on, sample, you cannot take.
Guy, we used to do that too. We used to do that. Like, that's why when I see even Reds that actively and in relation to not be toxic, like you see this person is really working hard to shift, like change the narrative. This is not the type of doctor. Like I used to actually be so proud of them. Like any particular one, it's an SR now. Everybody knows. Like he's like zero. Like sometimes like you just say it's not a big deal. Like he's telling his fellow, like, because he's a
call the person.
he's charity.
Credit,
like I know that some households have like a rascal, like you deserve to be punished. Like some people actually like very, like some people can be quite untrainable. Like you just don't want to learn. Like and I think it's just a foolish thing for something that is 1 year and you don't want to do it. Like this how you don't want to do something so badly, just get it done. Like you don't want to do this house job thing, just finish it. Because the longer you're misbehaving, the longer they are extending your stay. So you're suffering the more. Like you're just no.
He's already talking about protecting you, even physically, like protect yourself physically, go and get vaccinated, or like any form of physical protection. Once you see patients, once you just see a patient
is aggressive by changing words. Oh no, it's not correct. No, there's no need to do that with anybody. Just face.
Because if anything happens to you, just this happened to this doctor.
Nigeria, like you just come and they post you. What's this guy on Twitter? The Nigerian doctor. They just supposed to make a long thread about how Nigeria. The song is that they will say Nigeria happened to you, and your family will bear the brunt of everything, and they will be sad. They will grieve for a long time. But the main thing is that you've left the world, so please.
So like talking about protection, how like after a call or during a call, how were you able to? What's that thing you do to help you stress and like help you from burning out after a call or like during the call?
I think for during the call, it helps to see a familiar face. Maybe another hatred that's probably suffering like I am. Like maybe I'm just maybe working to get something from, maybe I'm on call in surgical ward and I have to get something somewhere else and I'm just working and I see someone, I'm like, alpha. We just laugh and make jokes like, guy, they suffer. Hey, how's your call going, man? We just say patient and say, I mean, the person is having it harder than I'm having it. I'm just laugh. Like we're just trying to make fun of the misery that we are going through. So we'll just go. I remember one time, I think, again, because my cousin said internship, like in my center too. So he's a medical scientist. So I remember one call like that. I was supposed to go and give, because I was giving drugs downstairs and upstairs. So I was done with downstairs, but I was already tired. So I was like trying to muster energy to go upstairs. Then someone just stabs me. I just turned. I just hugged him. Like, oh my god. My Sheila. I was so happy. Like it was so, like it felt so good to see someone, like it felt so good to see someone that was like, it just like, this energy boost. Like I felt really good. I was like, yes. It was just telling me, oh sorry, that don't worry, like the call will soon, like it just felt good that I saw someone. So I think that's what used to help me with, like, while I'm on call. Like even sometimes you're working with some very chill nurses that like are your friends and people are just like, if you just this small, you just know. And also, like another thing that used to help me survive is that I used to just like I'll just read the room. I know when I need to leave this place, because the more they see you, the more things come up, the more people have complained, because I'm like, if she sleep well, sometimes when I'm leaving a particular ward, because like in new place now, like we have like in cubicles, like there are rooms. So I just look around and everybody's just, how like that point of the call when patient relatives are brought out, they are sleeping, so like everybody's calm, like the night is everybody's just supposed to sleep and wake up. So I'll just look, I'm like, okay, it's time for me to take my leave. So I always looking out for that time to know, oh, when this is the time I'm supposed to pay it from this place. Then after call, like ending that call by like when call end, call should end. Like 8 a.m. call has finished. Like all these calls that will prolong. You know when you're in newborn or you're in chair, like you have to wait for the next person that you're handing over to, and the person is coming late. You now have to wait. Like before you're done documenting and everything is like 10. Like this is like just God. So sometimes I'll just try to, because this one now, because we're working the next day now, you cannot even say,
Yeah.
oh, maybe, but if it's a call, then maybe a Friday call, then I can just go and sleep. I'll just come back and just sit down my thinking seat for some time. Just think about how medicine is like one of the craziest things I've tried to do in my life. Then I'll just sleep. I think it also helps for me. What also helps me is that I have to think about, like, as the call is ending, I'm looking forward to, oh, what am I supposed to eat? Because most times, like, I don't want to actually call out my center, but alcohol food can be crazy. Like alcohol food can be trash. I'm not even sorry. Like alcohol food can be crazy. Jesus Christ. Like especially that okra soup. Like sometimes I'm passing, I know today is maybe Thursday and it's okra, and I'm passing that kitchen, I'm just looking at this women. But they did that rubbish. But they're making that rubbish with to make. Like too many cooks. Like why would they even do, all of you cannot just make soup that maybe you can say the soup is watery but it tastes there. It's just bad. Like it gets bad to the point. I remember when I was in pedo, like you come and see the flags there. Nobody is eating it. Like it takes a particular race that will just come and share the foods, maybe patient relatives, like all those indigent patients that don't have money for food, they'll just have to eat it because, and you're like, you expect me to give my best, but you can't even feed me. I can't even give me like the least of my worries should be what I'm not supposed to eat.
Like call food should be like the
The least thing, like, but I'm thinking like if I'm doing call now, like on, because I think this, like my last rotation that was internal medicine, like most of my calls were usually on Wednesdays, either Wednesdays or Monday, Wednesday or Monday, and I don't eat. I think it's probably jam beans. So I never ate call food. Oh my God! Like the 3 months I did internal medicine, I didn't eat call food. Like I had to make plan for what I was going to eat that night. And sometimes because like I'm too, maybe on Monday now I'm too tired, I'll just buy snacks. That's why all these things say you're doing call, you're suffering, but you're still adding weight.
Don't be stressed.
You just be stressed eating. I'll just buy. One day I was buying snacks and my chief just plus all these things for you. I was like, Chief, I'm on call. Don't judge me, please. I was like, okay, makes sense. So it's just because you just be tired, you'll be hungry eventually in the middle of the night. Then you go and think about what you're supposed to. I can't eat because if you eat that beans, you might end up your whole call. Like, because you don't have to be watching your stomach. Like, you can't be purging when you're on call. That's like,
That's crazy.
and so it can't be, so you have to be sure of what is entering your stomach. So me, I have to just go back. Sometimes I'll just buy, see if I go Sabacha. If I go that woman finish my money, but it's fine. Fago Sabacha, I see parfait. Like, even you see, you owe me parfait, get me parfait. So you see, was like, I'm one of UC's loyal customers.
Yeah,
Even though now she does not care about me so much. You see, I'm still this shorty. You don't care about me anymore. She used to ask me if I want parfait again. But guy, like, UC's parfait. I even had to find. There's one other parfait place I also found because like UC finished and everything. Sometimes I'll ask that she doesn't have. I know I need parfait. Like I want the whole. I like that whole granular everything going on. So yeah, I found one other babe like that, but she's equally not consistent. So, but most times it's just either I get about that Fagos Abacha, I'll just get parfait, or maybe I have maybe exercise around, she makes food for me, or like my friends buy food for me. So,
I thought of
yeah,
outsourcing.
yeah, like Jesus Christ, Jesus Christ, like you have no business.
No, you have business.
You have business. So sorry, I'm sorry. This is my personal preference, so it's not any rule. So it's just something that works for me. Like it's just something that I remember that what you said. This guy is fault. So it's like something that I'm sorry, but I cannot finish. I cannot finish work and come back and use my. Maybe I will call on Saturday. I will come back and start washing, start cooking, start cleaning. Oh, maybe my classmate. This is my turn to wash the toilet and bathroom. Like I can't do that. Like I realized at some points, like initially during house job, I was doing all these things, but it didn't hit me like all these. If it's not absolutely necessary, like another person can actually help me to do this thing. Until like one day I was just watching someone start. It's like that's why like social media is very social media can actually like really influence you. So just someone that was saying something about how like she missed when she was really missing how like where she trained, like they had someone that used to come and really wash clothes for like chicken money and the rest. So I think I now asked one of my friends how far. She wanted to know there's someone that actually come to do this thing for her for like not something that is not outrageous. Then she gave me the woman's number. then I talk to her and we start working out something. Like it's not good. Like some days I'll do call, like it's not very stressful. I'll do my laundry myself. But you see those days that like no, like I had to just use her. Like on those days, like outsourcing really, 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 really like helped me. Outsourcing some like so many things really, really helps me. Like
this they usually say that, oh, there's no time in house job, that you cannot, like, the only thing you're doing is work, 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 work. Is it really true? And in respect, like, as a Christian, like, you feel your relationship with God, is it that there's no time, or is it the fact that, oh, you're just tired? Like, you're just tired. Like, you cannot even, when you're not coming back to pray or read your Bible, because you're not even thinking straight. You're just coming back to sleep. Is that what it is, or is just there really no time?
I think both sides. Like there's actually I think both sides actually. I can't say there's no time. I can't say there's time. I think it also depends on the rotation,
Yeah.
the unit you're currently in. I remember when I was in ONG, I had a little time to myself. Like I had it was more flexible for me. I could still show up. I could still do stuff like even devotion and everything. I could still do that like consistently. Then Pete too. Somehow I had time to even like run off my calls, go for a birthday party, or just hang out with my friends. But as like maybe with surgery now, it was more like I actually did not have time. Like I actually did not have time. What was even saving me devotion was trying to reflect, like having my bath and I'm listening
Yeah,
to Pastor,
seated.
yes, listening to Pastor, and I'm like, okay, this is just maybe this is the only Bible thing that you're going to do today, at least this morning. Let it be something that I can do.
I actually agree. I also think that because I did my house job in the north, but and I saw the way, like, Northerners, like Muslims,
Yeah, okay, priority, huh?
their priorities. I think like it's also like a really like a priority. Like, no, I'm not saying that, oh, you should not be like, definitely not. I'm just saying like also like a priority thing, because even you see they're like doing like, okay, because it's like a Muslim. I don't say it's a Muslim state, which is not a Muslim state really. Yeah, but you see, because there are Muslims there. Once like maybe like it's 12, they will just carry themselves
Go and
and go
pray.
and pray. You get, or even during rounds, I had a during my one Dr. Rabi. There's something that they usually wear that they used to count when they're praying. Like, you see her person and she's like praying around,
Actively doing that.
actively doing that thing. So it made me really conscious that like, it made me conscious, like conscious that I don't have to wait till maybe I get back to
Yeah,
pray.
like you have to pray on the go.
I can be praying, like, as I'm doing rounds like this. I can just be praying. Like, I know, okay, God is in my heart. God is here with me. So I'm praying there. Like, I'm talking to God as I'm there. Because I'm seeing people doing, like, I'm saying, like, we can be talking in the corner room. I can be talking like this. I smile, open her bag, bring her mat, and spread it, and start praying there. I'm serious. Like, so, like, you just see it, you be like, is this appropriate? It's not about whether it's appropriate or not. It's just the way they live. Yes, I think it's like a consciousness thing, knowing that, oh, you don't have to wait for, or maybe
Perfect time.
you don't have to wait for a perfect time. Like, even that you're tired, be telling God, Jesus, that you're really tired, I really need this help. Like, really being conscious that at every time of the day you can do it because you have God inside your heart. You get, so like I feel like everybody has to, every house job, like even not about house job, like even normal living, because even 9 to 5, like,
Even 9 to 5 is not easy, man.
it's not easy. So I feel like as you're on the go, you really have this consciousness of God, and say that, okay, I need God, I need God. Like, not I need God, be telling God, oh Father, I need you, I need you, I need you. Please help me. Like, all this simple, please help me, please help me. All this, like, God, I beg.
God, I beg.
Excuse me. I say that, God, I beg,
God,
like
I
2 years.
beg.
God, I beg, like,
God, I
be
beg.
begging God as you're going, like, yeah, but like just like the consciousness, really, like just having the consciousness, yes. So like money, people don't usually, we don't often talk about money, how it's true.
I say.
But this one will be fast because of time. Like, we just have to like talk through it. Like, you can choose centers based on all the pay. Like, I think currently, I think like Star Parking pay is like one of the highest
Yeah,
currently,
in the
like in the
country, yes.
country. Yes, like one of the highest now. So like having to
You work
manage
for that money, man.
having to manage that money, knowing that you will not be a house officer
Forever.
forever. So you have to like save, invest, budget. No, like, you know when guy, like, when you're starting salary is that amount, like it will do something to you. You just hit, maybe you were trying when you were in school, you were trying to go nice and all, like, but when you ask that money, like, you now forget about, oh, I have this to do, I have this to do, I have to do. You just start eating from this particular place, doing this. When, bro, like, you need to like be saving that money for the future. Like, you save, just like invest, not just like spend. You don't increase. I've forgotten how they call it increasing your, because of you now have big
I
your
think you have to actually be very, very conscious. If
really
not,
conscious, because there are a lot of things that will take your money. Like,
yes,
a lot of things that are seemingly really, really legit that you need to spend on.
Because like me, like I was very intentional about saving during house job. I was like, I must save my house job salary, like part of my house job salary. Like, because I remember what I kept remembering was that when we were doing our final year week, that we invited Dr.
Dr.
Pasta.
Pastor, it told us,
She write down what you want to save.
save.
Did I save that the amount I read that to save from house job? I swear, like I know I would have done better because given the amount I was being paid. But the main thing is I wanted at the end of the day, I wanted to have something. Yes, have that amount by the end of house job. So I think what I did was once I receive my salary now, I just remove that amount. Like I send it to another account. Like that's the first thing I'm doing. Like I'm removing it before before I even start to budget. Like that money is out, then I'll not say, okay, this is my salary. What do I do with it? So you get, but I don't think I was just saving. I not do the whole investing stuff. But then I also did. I think there's something else I also did. I don't think it's a financial. I don't think it's. I was investing in myself too.
We're buying new clothes.
I was buying new clothes. Like I'll buy some things. But I'm like, at some point in my life, am I going to?
And the fact that Nigeria, like, it's actually because currently the country, bro, like, what would be this price today? Tomorrow is another price.
So I'm like,
you might as well get it today.
Why that you need? Something that you know you need. Because actually, the things I will get to, like things that I know that I will need for a long time. Like there's no better time to get it other than today. So you get. So I was actually doing it like every month. I'll just try to maybe just one thing that I'll add to something that I already have. I'm like, okay, this is something I bought for myself this month. Tell yourself because sorry for like I don't know. I feel like the more money you make, the more your appetite like you start wanting things that normally you know, like you start desiring somewhere.
Things that you can afford this.
Yes, like even some things that normally like you'll be like, oh, this thing is too much for me. I think it's somewhere I cannot go back on. Like there's some things now that before I'm like, hey, but now I'm like, okay. I'm like, hey, when did I become this girl, please? Give me money. Like when did I become this person? Like there's some things that have shifted, like financially for me. Like I'm like, okay, this thing can work, this thing can. So yeah, that's basically it, man.
Yeah, and it's not like you have to make these plans of saving and investing before house job.
Before you receive your first salary.
Before you receive your first salary, like already planned. Okay, this is what I would do. Okay, this is what I'll do. Not when you have now like received the first salary. You're not like thinking, oh, what should I use my money? You're already late. Like if you're still thinking about, okay, at this point, what should I use my money for? And nah.
I know how some people also have like many things. You say, oh, your first salary, you give it to your parents. Your first salary, you tithe, you give it to
whatever
God.
it is you want to do with your first salary.
Really, not before you receive your first salary.
Because you not be thinking, I already remove 10K from that.
I swear.
And so if you're a federal hospital, you need to pay late.
I said they'll pay you when the money are finished. Like you finish,
but already choosing the money. So it's better you just like begin to plan your finances, especially like house job money. Like really plan it because well, some people like just come out of house job and they're starting like chronic PP. So the money.
No shades though.
No, definitely no shades. Hey. End of this video. Don't forget to like. Don't forget to comment.
Yes.
Don't forget to share this video to as many as like I feel like as many young doctors
I get to watch this video as possible. Yes, please
share it, subscribe to this channel because you know if you subscribe, if you comment, to help to know okay this is what people like and like to create content around it and all. Yes, please if you have any questions, any clarifications, leave it in the comments. And then for the gift I talked about, I already created a playlist because you know people usually want to which centers do house job, and you know this like house job questions, which centers to do house job, maybe the documents you need, maybe the things to consider to before you choose it. I really created a playlist of videos on YouTube. I really like researched. So I've already created a playlist and I'll link it somewhere in this video.
You should make sure you subscribe to Street Sometimes. Guy, so intentional, man.
So like you can just watch those videos to get all these other like finer details about like the house job process before like getting into like the house job.
That's really beautiful. Oh, that's really beautiful.
Yes. So next time.
I know when I was waiting for house job, I was watching a lot of YouTube videos.
Yeah,
I was actually looking for. So I know that people are actually looking out for this type of videos. So.
Yeah, so I think I really made it. I just I just made playlist of like the videos.
That's really nice.
So you can just watch it. Yes, and don't forget to subscribe.
So can I wear my shades now?
You can wear your shades.
Hey, what? Yay!